What diagnostic tests lead to early bone cancer interventions? Detecting bone cancer early can make a big difference in treatment success and patient outcomes. When symptoms like persistent bone pain, swelling, or unexplained fractures appear, doctors will usually recommend a series of tests to investigate further. These tests help confirm whether cancer is present and determine its size, location, and whether it has spread. The first step often involves an X-ray. It is quick, widely available, and can show abnormal bone growth, areas where the bone has been destroyed, or fractures that might suggest cancer. However, X-rays might not catch very small or early tumors, so additional imaging is usually needed. Next, a computed tomography scan, or CORT scan, provides detailed cross-sectional images of bones and nearby tissues. It helps doctors see the size and exact location of a tumor and check if it has spread to nearby organs or structures. This detailed view is essential for planning treatment options. Magnetic resonance imaging, or MRI, uses powerful magnets and radio waves to produce highly detailed images of bones and soft tissues. It is especially useful for understanding how much a tumor has grown within the bone and how close it is to nerves and blood vessels. This information guides surgeons and oncologists in choosing the best approach. A positron emission tomography scan, or PET scan, involves injecting a small amount of radioactive glucose into the body. Cancer cells tend to use more glucose than normal cells, so they appear brighter on the scan. PET scans are particularly helpful for detecting whether the cancer has spread to other parts of the body. Often, PET scans are combined with CORT scans in a PET-CT scan for even more precise results. Bone scans are another tool used to identify abnormal bone activity. They involve injecting a tiny amount of radioactive material that highlights areas where the bone is unusually active, which can indicate metastases or widespread bone involvement. While useful, bone scans are less specific than other imaging tests. Blood tests can also provide clues. Although no single blood test can diagnose bone cancer, markers like alkaline phosphatase may be elevated in some cases. These tests help assess overall health and can prompt further investigations if abnormalities are found. The most definitive test for diagnosing bone cancer is a biopsy. During this procedure, a small sample of bone tissue is removed and examined under a microscope to confirm the presence of cancer cells. Biopsies are crucial because they tell doctors exactly what type of bone cancer they are dealing with and help guide the best treatment plan. Sometimes, a bone marrow biopsy is performed if there is concern about cancer spreading to the marrow. Early diagnosis depends on recognizing symptoms and seeking prompt medical evaluation. Since there are no routine screening tests for bone cancer in the general population, awareness of symptoms and timely testing are key. These diagnostic tests are essential tools that help healthcare professionals intervene early, which can lead to less invasive treatments and better outcomes. Always consult healthcare providers for personalized advice and diagnosis, as each case can vary significantly.